Hello, my name is Dori Kleesis and I'm with Mount Sinai. Today I'm with Dr. Stephen Burakoff, the Dean for Cancer Innovation and Chief of Pediatric Oncology at the Icahn School of Medicine in New York. He was the director of the Tisch Cancer Institute for many years and helped it achieve its NCI designation. Dr. Burakoff, thanks for being with us.
Glad to be here.
You've been at this cancer field for quite a while and you started your career in Boston treating patients with chemotherapy. How far have we come since that?
So what was really exciting 40 years ago is we started achieving cures of kids with cancer using very toxic drugs. And that was the first revolution in treating cancer. The problem as we follow these kids over time, the treatments we used created so much damage of their DNA. Many of them are developing second cancers a number of years later. So what has changed in the last 10 years, and in my study of immunology, we have learned to harness the immune system, our own immune system, which was developed to fight viruses and to fight bacteria to keep us free of infections, and now have it directed at tumors. What is extraordinary about that is the achievements we've seen in the last 5 or 6 years, and in fact, it is much less likely we're going to have long-term what we call side effects or toxic effects. So this is truly a revolution for those of us who are fortunate, have trained in immunology, have been involved in cancer treatments over many decades. This is probably the most exciting time I've been involved in my entire career.
And so how far have we come in what types of cancers in terms of using immunotherapy to treat cancer?
So the first treatments of diseases that have gone extraordinarily well involve both lung cancer and melanoma, this very, very malignant, aggressive skin cancer. Both of those 5 or 6 years ago were lethal. If you had metastatic melanoma, meaning it had gone to other parts of your body, or lung cancer, your life expectancy was a year at most. With immunotherapy today, for example, in lung cancer, one drug is now having 25% of patients with lung cancer, all of who would have died in a year, living over 5 years, and some of them are probably being cured. We're seeing 35% of patients with melanoma, this very malignant skin cancer, living 5 years or longer, and also some of them are going to be achieving cures. So this is one drug, first efforts in the last 5 or 6 years. What we may be able to bring forward with other immunotherapy drugs to further enhance our immune system is going to be spectacular. This is truly a revolution in how we're treating cancer.
And is it important to, when you have cancer, to get a panel of the mutations that the cancer has? Tell us the importance of that.
First of all, I think today cancer treatment is so specific. 20 or 25 years ago, you would go to an oncologist, a doctor who treated many cancers. Now everything is very specific. We have physicians who only do prostate cancer or lung cancer or breast cancer. It's really important to go to a center, what we call a tertiary center, which in fact has subspecialties in cancer. And what they will very often do is look at your tumor, look at the kinds of changes and mutations they have, and that will in some ways, in fact, identify or define some of the treatments we will bring forward.
So what's the future like? What hope can we give patients?
Well, I think, what we've achieved, as I said, in 5 or 6 years, it took 40 years using chemotherapy to achieve many of the cures that we have, again, with many toxic effects. I think you're going to see in the next 5 to 7 years, multiple other immunotherapy drugs coming forward. And I think we're going to find over time, we're going to have more cures, more long-term survivors. We have evidence in kidney cancer now that we're making inroads. There are a number of prostate cancer may in fact be amenable. There's new early data in breast cancer that immunotherapy may play an important role together with chemotherapy. So we're really just at the beginning. This is the frontier of what we're seeing in terms of treating cancer with our immune system.
Thank you, Dr. Burakoff, for joining us.
Okay, thank you.